Good evening. It's a great pleasure to be here. It's really a wonderful and fun event. I spent a year of my life studying digitization in healthcare because I was so pissed off. I had been waiting for digital to enter the world of healthcare for a couple of decades after seeing it roll through the rest of my life. Incredibly excited about it, thinking that it was going to solve all of our problems. And I saw that it solved many problems, but it was creating others, many of which were unanticipated. And I really came to believe that we would get there, but it was going to take some time, and it was going to take deep partnerships, and particularly partnerships between innovators and entrepreneurs and delivery systems and doctors and nurses and others and patients trying to figure it out together. There was no way, as I studied it and interviewed members of the technology community, they simply didn't understand enough about how medicine is practiced and what the experience of being a patient was in order to get it right. And I think for us in academia, we don't understand enough about things like scaling and building technologies and business models. And so one of the things that's so exciting about tonight is really it's the incarnation of something that many of my colleagues have been working on for a while, which is bringing these two communities together in the place that we're all lucky enough to live in, to try to reach a new place where we're going to make healthcare better and safer and more accessible and more equitable and less expensive. Now, it's a little bit odd that I have been asked to announce the award for consumer wellness and prevention. First of all, I don't engage in any of that personally. Second of all, my probably main claim to fame in healthcare is I started the hospitalist field and coined the term hospitalist, and that's the only clinical work I do is taking care of very sick people in hospitals. So I am reminded with this award of the immortal words of the comedian Red Fox, who once said, "Health nuts are going to feel stupid someday, lying in hospitals, dying of nothing." The hope is that these companies will be wildly successful in what they do, and patients will actually not lie in hospitals dying of nothing, but they actually won't make it to hospitals. They'll stay well. They'll stay out of hospitals. They'll stay out of emergency rooms, and they'll live their lives healthier and better for it. And so the companies in this space are innovating. It's actually one of the more exciting spaces in healthcare, if you think about it, because there's so much of the work in hospitals and clinics that is hyper-regulated. This is a space where I think there's more freedom to innovate, and so I think we're seeing that in these companies. And the nominees in this category for consumer wellness and prevention are Butterfly Network, Ada Health, GoodRx, and Hello Heart. And let's see if I can get this thing open. And the winner is Butterfly Network.
Well, thank you very much, UCSF Digital Health and the sponsors. Super excited to be with you this evening. In short, what we've done is rethink ultrasound, which is a harmless and really universal imaging modality, but it's been the same for about 50 years since it was first brought into clinical use, and so has not been accessible to 2/3 of the world thus far, and the vast majority of healthcare professionals. And so starting from the ground up, we took the ultrasound, and we shrunk it into a tiny chip, similar to a digital camera to see inside the body. And now the entire machine can fit in your pocket and at a super affordable cost compared to the alternatives, and with AI and cloud features to make it easy to use. We hope that it can have the impact that ultrasound should have, and already seeing phenomenal take-up and wonderful stories coming from our early customers. So thank you all for that. And thanks for the team at home mostly for doing all the hard work, and very nice to see you all. Thank you.
There you go.